Doctor, I've got this rash. I don't know if it's shingles, an insect bite, or could it be something else? So let's talk about how do I know I've got shingles. Shingles is caused by the varicella-zoster virus known as the VZV, which is the same virus that causes chickenpox. What happens is, as you know, when you have chickenpox, you get all these rashes over the body. These rashes disappear over time, but the virus stays within the body. It remains dormant, as in it falls asleep, and then settles within the root nerves, otherwise known as the dorsal ganglion. So they can stay dormant for many years undisturbed until maybe you're feeling stressed, you're ill, your immune system is run down, or you do have a compromised immune system. For example, you might be on a treatment such as chemotherapy, or you're taking several medications that might compromise your immune system. So what happens? The virus gets reactivated. So therefore, you cannot have shingles if you do not have a history of chickenpox. If you're not sure if you've had a history of chickenpox, you can easily go to your doctor, do a blood test, and look for antibodies to the varicella-zoster virus. If you have antibodies to the varicella virus, that tells you that you must have had chickenpox in the past, either as a child, without remembering that you had chickenpox. So remember, you cannot have shingles if you do not have a history of chickenpox. Also, when the virus gets reactivated, the first symptom you will feel is pain. Pain usually precedes the rash, and that's the clue to shingles. So the pain starts in a specific location. Usually the most common area could be around the back, around the breast or the rib area. You might also have it on the face or on the forehead, and usually it's unilateral, usually appears on one side of the body. So you get this pain, or you might get this burning, tingling sensation. Then 2 to 3 days later, the rash appears. Now the rash can be a red rash, and they come up in little crops of blisters. They're usually together like clusters, crops of blisters, water-filled vesicles. And again, the burning, tingling sort of sensation. And again, they're in the same region as where you had the pain. It might be the forehead, could be around the cheeks, could be around the back, around the chest. They can be slightly itchy as well. And if you're severely compromised, sometimes you notice that the rash now starts to spread. The pain becomes more severe. And 2 to 3 days later, the vesicles then erupt and they begin to crust. But in certain cases, you might still see vesicles appearing within a 7-day period. So if you have shingles, pain, then a rash, tingling, burning sensation. However, you need to treat this as soon as you can. And treatment is most effective within 72 hours of when you first notice the rash. So if the rash came on day 1, you want to get the treatment day 1. Okay? By day 3, you would say the treatment is 70 to 80% effective, because ideally you want to start the treatment on day 1. However, you can still treat by day 5, day 7, especially if new vesicles keep appearing. However, by day 7, the treatment is 45% effective. By day 10, the treatment is 20% effective. So though you can still take the treatment, it's less effective as the day goes on. Now, what is the treatment? The treatment is antiviral medication, usually in the form of acyclovir. You've got other brands like famciclovir or valacyclovir, but acyclovir tends to be the first choice, mainly because it's cheaper and does not have as much side effects as the other medication. So your doctor would usually give you an 800 milligram dose of acyclovir to be taken 5 times a day for 7 days. And what acyclovir does, it stops the multiplication of the virus and reduces the risk of what we call post-herpetic neuralgia, which happens when the virus has damaged the nerves. And what happens is, if you do not treat these shingles on time, or if you take no treatment at all, you might get this constant burning pain in that same area of where you had the rash that can last for at least 3 to 6 months. And because the pain is so intense and burning, your GP will now give you neuropathic tablets such as gabapentin, pregabalin, or amitriptyline to reduce the severity of the pain, which I said can last for 3 to 6 months. Now, I talked about shingles appearing on one side of the head. Now, the main concern is if shingles starts appearing around the eye, you might notice crustiness around the eyelids, blisters around the eyelids, pain, again, itching, tingling sensation, and some people might experience ulcers in the cornea of the eyelid. This is an emergency because now you have what we call ocular shingles or herpes zoster ophthalmicus, and I would expect you to go to the eye hospital or your nearest emergency department on the same day. You need a acyclovir treatment straight away. It's usually given for 7 to 10 days. If you have ulcers in the eye, you might need the acyclovir ointment as well to rub into the eye. You're going to need painkillers, and you're going to be monitored every day to make sure the treatment is a success And I know in some severe cases, some people are actually given a cyclovir as an IV, which is a drip through the vein, because it tends to work quicker. Now, people would ask, can I catch shingles from somebody else? No, you cannot catch shingles from somebody else who has already had shingles. However, if you've not had chickenpox, you can get chickenpox from somebody who's had shingles, and that is by skin to skin contact. But if you touch the rash or the blisters, then you're most likely to catch chickenpox. So if you have shingles, you then have to make the decision of whether you need to go to work or make sure that that area is well covered, that no one has access to that area. Now, can school kids get shingles or children get shingles? I have seen this happen. Shingles is rare in children, but children can get shingles, especially if they're run down, they're immunocompromised, and if they've also had a history of chickenpox. If you're over the age of 50, you're at risk of shingles. If you're on treatment such as chemotherapy or taking medication that suppresses your immune system, you're at risk of shingles. If you're feeling very stressed, run down, you're at risk of shingles. If you've had a history of chickenpox in the past, you're at risk of shingles. So high-risk groups tend to be given the shingles vaccine. The shingles vaccine is quite effective to stop you from getting shingles if you're at risk of having shingles. There are two types of shingles vaccine. There's one called Vostavax that's given as a double dose, while the Shingrix is given as a single dose. Now, the Vostavax has the weakened version of the virus and is likely to cause shingles if your immune system is very compromised. So your doctor might give you the Shingrix vaccine instead of the Vostavax. So make sure you know that you're getting the right shingles vaccine depending on your immune system. So do remember to identify that you have shingles. Remember, it usually starts with pain, and in 2 to 3 days later, you notice a rash, which comes as a crop of blisters, usually on one side of the body, and then it can travel down if you do not get treatment within 2 to 3 days. You must have had a history of chickenpox to have caught shingles in the first place. Now, I hope you understood this video. Please feel free to share, like, and subscribe.